Autism Diagnostic Aid. Autism Spectrum Disorder, ASD, is a lifelong neurodevelopmental condition characterized by difficulty with social interaction and communication, as well as restrictive and repetitive patterns of behavior. It is a common disorder, diagnosed in about 1 in 54 children. ASD is usually diagnosed by a clinician with expertise in the field such as a developmental pediatrician, child neurologist, or psychiatrist. The diagnostic process often involves lengthy clinical assessments or standardized testing batteries that take several hours to administer. Therefore, wait times for an ASD evaluation can be very long. While symptoms of ASD may appear as early as 18 months, and diagnosis can be made reliably by age 2, many children do not receive the diagnosis of ASD until much later, resulting in treatment delays during a critical developmental period. A timely diagnosis is extremely important because it is needed to receive appropriate early intensive intervention services, which are more successful if started during the early developmental period. To address these challenges, a team of researchers has been developing technologies aimed at making an ASD evaluation simpler and more accessible. This diagnostic aid device is intended for use in primary care settings, along with a clinical assessment, to help establish a diagnosis of ASD in children ages 18 months to 5 years who show symptoms that may be ASD. The idea behind the device is to target the most important portions of an autism evaluation and to condense them into a much shorter form. Most of the patients with an indeterminate result had various forms of developmental delays that were more difficult to determine, including ASD and other neurodevelopmental disabilities. The data has not yet been published, but was provided to the FDA for review during the approval process. ASD diagnosis in some children who exhibit worrisome symptoms, and to accurately identify those who are unlikely to have ASD. This may help accelerate and streamline the process of diagnosing ASD, and could limit long waits for specialized evaluations. While the preliminary data suggests that there are high rates of indeterminate results, particularly in children with complex neurodevelopmental presentations, primary care providers will be prompted to pursue further neurodevelopmental evaluation for those children.